This will be a balance between getting our economy going and protecting our residents and our employees of some of these businesses. It's a delicate balance, but it's one that I think is appropriate. We've made this decision based on the data from our pandemic task force, from our hospital systems, and from our public health officials. Meanwhile we'll continue to be getting more tests in St. Louis County, and we'll be doing much more testing. We will soon be able to make sure everyone who has symptoms, regardless of health history, can have a test in St. Louis County, and we will begin testing asymptomatic individuals in high-risk populations. Earlier this week, we talked about some of our efforts in nursing homes, which really is a high-risk population that we're paying a great deal of attention to. I'm often asked, will this reopening, a gradual and slow and cautious reopening, lead to a spike in cases? I don't expect a spike, but I do expect a bump. We will be doing much more testing, and with more testing, testing groups of people like those without symptoms, we will see more cases. We also will have more people moving about St. Louis County, and the risk of transmission is also higher. But I do also believe that people in St. Louis County have become more comfortable with social distancing, with wearing a mask, and avoiding large crowds. This is what's allowed us to be where we are today, with a dramatic reduction of the cases in our community and the rate of cases in our community, and put us in the position to have a conversation about reopening. On April 28th, we reopened 33 of our parks. On Monday, we're going to reopen 21 more. We will still keep our restrooms closed, our courts, other indoor park facilities, and we will continue to maintain social distancing, which has allowed us to keep our parks moving in the right direction. You have heard me say before, and I'll say it again, this is three crises. This is a public health crisis, a humanitarian crisis, and an economic crisis. So what I've done to protect and to help our 30,000 businesses in St. Louis County is to create an economic rescue team by executive order. I specifically asked the economic rescue team to provide me with input on economic issues for workers and businesses related to the COVID-19 pandemic. This means that they will be the eyes and ears of my administration during this recovery. They're designed to play an important role in the economic recovery and to make sure we have the proper environment for our businesses as they begin to come back online and to grow. The Economic Rescue Team will have a steering committee, and this will be of 5 individuals, and there will be subcommittees as well. The steering committee will be chaired by Rick Stevens, who is president of Christian Hospital. Also on the steering committee will be Frank Jacobs, the president of, or the business manager of IBW Local 1. Vita Jeffries, who is the executive director of the St. Louis Black Chamber of Commerce. Kelly McCoy, the former chief of staff of the CEO of Starbucks. And Jeff Pittman. Jeff is the chancellor of the St. Louis Community College. And this committee will also bring together groups of county residents who will focus on specific sectors like restaurants, workforce development, real estate development, and other important features. We're going to be getting advice from this group, our economic rescue team, on the best way to spend the CARES Act funds moving forward to help our businesses. As we continue to watch this pandemic, we will continue our focus on high-risk populations. We also will be focusing on our Justice Center and our Juvenile Justice Center. We've started new cleaning and disinfectant protocols, new screening protocols. Anyone who's been admitted to our Justice Services Center is quarantined for 14 days before they're allowed to mix with the general population. This weekend, we're going to offer testing to our staff in the Justice Services Center and the Juvenile Justice Center, and we'll be doing that for everyone who works in both of those locations. We'll also be testing all of our inmates in the Justice Services Center and all of our inmates in Juvenile Justice Center. We previously have had no positive tests among our inmates in justice services. We had 2 corrections officers who tested positive, were isolated, and they have fully recovered. In the Juvenile Justice Center, we have 7 juveniles who tested positive over the past month, and 3 staff members who tested positive as well. What we're doing with testing all of our staff and all of our inmates in justice services and all of our juveniles is a proactive measure, again recognizing that this is a high-risk population. Both of these populations are predominantly African American, and we know that this group has been disproportionately affected by the COVID-19 epidemic. Anyone in our care has our responsibility to treat them with dignity and respect, and we will continue to do so. We believe that the measures we've taken so far to protect these individuals from COVID-19 have been effective and important in limiting the impact in this population. We've seen some devastating results in some of our jail population across the country. I appreciate the work of our public health department leading this effort. Before I take any questions, I would like to announce that I learned about 45 minutes ago that about 6:30 this morning, or 2 hours ago, we had a death in our jail. This was not COVID-19 related. I don't know any details right now other than this was a 32-year-old individual, and this was not a COVID-related death, and he was in our custody for less than 24 hours. As always, there will be a thorough investigation. We'll release some preliminary information when we have it, and then the follow-up will take a little bit of time. And I'd be glad to answer any questions. Yep.
Has St. Louis County CARES dedicated any of the CARES Act money to help the city of St. Louis stop the spread of infection in the city?
Well, we have the St. Louis County CARES funds. Generally, we are required to make sure they're spent within our jurisdiction. Although we're cooperating with several regional efforts, our humanitarian relief is coordinated regionally. Our public health departments work regionally. So I'm sure there's some overlap in resources, but as a general rule, the requirements from the federal government are that the funds that were given directly to St. Louis County should be spent within St. Louis County. But so many of our efforts are cooperative, so it's very difficult to parse that precisely.
Just follow up. I mean, there are reports that the city has between 10 and 15 contact tracers when the national standard would be that they should have up to 90. There are small counties, everywhere in the country that have 20 to 30,000 people that have a larger contact tracing base than the city has. Is that a concern to you that they are not prepared to follow the spread of infection once the economy opens up?
So our contact tracers are working cooperatively with other jurisdictions. I'm not specifically familiar with what's happening in the city of St. Louis with our contact tracing program, but I know that our group is working cooperatively, and if someone from a surrounding jurisdiction, another county, St. Charles County, Franklin County, or Jeffco, or City of St. Louis, has someone who lives in one of our jurisdictions, we would certainly help them follow up with that individual.
But currently the city is only monitoring something like 50 or 60 people who would be under quarantine. I mean, they've added 250 new cases in the last week and a half. And you would think that 250 people would have some contacts to follow, but they're only monitoring 60 people. They don't have anyone doing this. So that seems to me to be a concern that would be, those cases, the people who are not being monitored live in our region and could definitely add to the spread of infection. Did you know about that? Are you?
I'm not familiar with all of the details of the City of St. Louis contact tracing program. I know that they have contact tracers that are working. I am familiar with what's happening in St. Louis County, and we're working very vigorously to set up our contact tracing program. I would expect that the City of St. Louis would have a responsible program as well. I just don't know the details of it.
Has the city asked the county for help with this at all?
I don't know about that. I know that we work very cooperatively with the City of St. Louis Public Health Department on many issues, procedures, protocols, Our business guidelines were developed cooperatively through our business leaders, and we will continue to do that. And if they need help with contact tracing, I'm sure our public health department would lend a hand. But I don't know the details of that specific relationship.
How many people are working on contact tracing in the city right now? I'm sorry, the county right now? I know that there is a request to hire 100, but I know that would take some time. So how many do you have?
We're onboarding, so the hiring is part of the challenge. We have 800 applications, and our first cohort that we're hiring was targeted to be 100. We had at least 70 volunteers working at one point. The rate limiting step is the training, and there's online training that's pretty extensive, and they train 10 new people a day. And since I first began talking about this, I know they've been training 10 new people a day. I don't know the exact number now. If we've gotten up to 100, we're probably pretty close to that, plus the 70 volunteers.
Do you have any updates on bars, specifically in the county, potentially being able to reopen since they are opening in the city on Monday? When I had talked to the owner of ITAP earlier in the week, they have said they don't have any locations in the county. They have one in Columbia where bars aren't open, and just had expressed some frustration that things can't really be merit-based. Understandably, you guys don't have the staff to go inspect every business. But for these businesses that feel confident that they can abide by the safety protocols, when are they going to be able to open?
Well, we're going to be watching that closely. I think the bars will be included in our next step. We'll watch the testing numbers over the next couple of weeks. We'll watch hospital admissions and all those things we track. And as long as we see appropriate social distancing measures, we're going to be working very closely with bars and other businesses that weren't in the group that's reopening on Monday to help them establish the right protocols and move forward. We're sensitive to that issue as well. St. Louis County has been particularly hard hit.
Would gyms be potentially included in that? I've seen a lot of different petitions going around about smaller gyms feeling like they can abide by the safety rules.
Yeah, we'll be working with the gyms to first develop standards that we think can be safe. We know that gyms across the country are considered higher risk for transmission of COVID-19, and that's why they are generally not included in the first round in a lot of places and haven't been included in ours. But we're sensitive to their needs. These are good people who are in a tough spot, and we want to help them be successful. We've been contacted by some gym owners, and we're going to work with them to create some protocols so we can move forward.
We've heard that police departments have to purchase PPEs from the county. Is that true, and why is the administration?
The police department?
Police departments who get PPEs from St. Louis County have to purchase them from the county.
Yeah, and so there are contracts through FEMA that regulate PPE, and as we move forward, we've had some requests about allowing them to not have to purchase those, and that's something we can consider under the CARES Act. No one's requested that yet that I know of, but that's managed through our Emergency Response Center, and which is actually run by, that piece is run by the County Police Department. We have a good cooperative relationship with our police services, with our fire services, and if they need relief from their current contracts, that's a reasonable thing to ask for and to consider. Right now, CARES has been focused on the public health response and on testing and contact tracing and humanitarian relief and buying food. We haven't been focused on revisiting some of those contracts. Most importantly, we were focused on getting PPE in the hands of police officers and first responders. But if they want to talk about those relationships and those contracts, I think that's a reasonable thing to bring up. I probably wouldn't do it today or Monday, but it's something that we should be talking about.
And also, do you know who received the shipment of protective masks from RBO Logistics? And do we know if they're sufficient to protect people?
I don't know anything about that particular shipment, those particular masks. That would be a level of detail that I would not be aware of, but we can try and find it out and get back to you.
Do you know if the county, if that was one of the manufacturers the county listed?
I don't know who they're buying masks from. That is a level of detail that I would not be involved with. Where they get their masks from, what the contracts are, that's done by procurement out of emergency operations.
Who would be the person to talk to that?
Michelle Ryan is the director.
Provide some details again.
Yeah, Michelle Ryan is the director of emergency services, and whenever someone asks about that, it sends me an email. It's forwarded to her or Spring Schmidt, and I just move that along. I don't know about those contracts.
Any updates on pools, summer camps, daycares,
Yep.
keeping the kiddos busy this summer.
Right, so daycare is important, and we realize that as people are going back to work, there'll be more demand for daycares. Daycares are open. There's guidance on our stlcorona.com webpage for those daycares. They're the same guidance as when they were only open for first responders, but they will be open for anyone. But the daycares will have to set up some different protocols to take care of the kids that they haven't had in the past, and those are on stlcorona.com. That guidance is there. We're working on summer camps, and we're talking about that right now. We hope to have some guidance out next week for summer camps. We have to balance the opportunity for crowded spaces with the need for childcare, essentially, for parents to have some place for the kids to go while they go back to work. A lot of people are going to continue to work from home. I think we have to recognize that this is a slow and cautious rollout moving forward, and that anyone who can work from home will continue to do that for a while. And some of our businesses who haven't been open will reopen, and there will be demands for childcare for them, either daycare or summer camps. We understand all of that, and we're trying to provide some guides for summer camps here in the next week.
Pools too, for parents who might
Pools
be
are a little more
crazy.
challenging. We don't have good data on pools. Every presentation that I've reviewed, public health presentation that I've reviewed for pools has had a big question mark about how to manage them safely, because we don't necessarily understand how this virus works, and we don't understand how the pools are going to be safe. But we're trying to provide some guidance on that as well.
And then what about with Memorial Day coming up, with the pools here closed? It's typically a big time when a lot of people travel to the Lake of the Ozarks, and I was shocked to see that it looks like all of the pools are open there, all of the Memorial Day celebrations are going on, and people are planning to go there. So, what do you want to say to those people? And it's also difficult for everyone following the rules here if a bunch of people were going to go to the lake and then we wind up in a worse situation.
Well, I would hope people would follow the rules, because our success in fighting this epidemic depends on the decisions that each individual makes, not the decisions that we make for them. I mean, in extreme circumstances, our state and local governments will step in with restrictions. But moving forward, a lot of our success depends on residents in our community accepting social distancing, accepting wearing a mask, and accepting these guidelines. And we hope that people will continue to honor the crowd restrictions. That's what will limit the spread of this virus in our community. Crowd restrictions here, or crowd restrictions when they travel elsewhere. St. Louis still has been hit much harder than any other part of the state, and we need to keep that in mind.
What would you say to someone who says, I'm going to go to the lake on Memorial Day, I have a boat, but I plan on going to the bars there? How much are they breaking the rules by doing that?
Well, they're putting themselves at risk, and they're putting people at the bars at risk if they don't follow social distancing procedures or wear masks. And this is all, it's a question of opportunity for the virus to spread from the lake to our individuals from St. Louis, or from our individuals St. Louis to the lake. I think we want to get moving forward with our lives as much as possible, but we do have to accept these social distancing measures. This is going to be the new normal for a long time.
You indicated earlier this week that you had 20,000, you had tested 20,000 people. How many tests do you have on hand now, and how many do you expect to get? And then what's the strategy for deploying those?
We're actually met yesterday with our regional leaders to develop a community-wide, a regional testing strategy. And I can give you the rough boundaries of that testing strategy, but I don't have the details. I know we have a few thousand tests on hand, and that we are ordering tens of thousands of tests. There are different types of tests. There's a saliva test that we're going to order and validate by testing it side to side with the traditional PCR nasal swab test. Once that's validated, we think that will help us test more people. But our testing strategy moving forward is to, by next week, be able to test everyone who has symptoms in St. Louis County, not just high-risk people who have symptoms. And then we will start to focus on asymptomatic people in high-risk populations, such as our Juvenile Justice Center and our jail. And we'll continue to test high-risk people in nursing homes who are asymptomatic, and then other congregate facilities or other people who have been exposed. But we're working on that regional testing strategy. It depends on how many tests we will be able to purchase. We're also initiating an antibody testing study where we test large groups of people in our community to see how the virus has spread somewhat undetected, and we're testing for exposure to the virus. Doesn't necessarily predict immunity. There's some discussion about that in the scientific community, what the presence of that antibody means, but it's not a guarantee of immunity. But that test does give us an idea of how it's spread throughout the community. So we're putting together our whole regional testing strategy. We have more tests than we had in the past, and we're going to continue to order them as aggressively as possible.
So are those tests mostly going to be given by the county health department, or are they going to be distributed to community health-based health centers?
We have many partners who are willing to test, and we will share the test as much as possible with our partners. The federally qualified health centers have a supply of tests, and they're purchasing more tests, but if they need help, we would certainly partner with them. They have been good partners, and they're working with us on a testing strategy. They're working with us to give us their positive and negative results so we can tally those. The hospital systems will continue testing. There are private labs who do testing as well, urgent care centers, and there's a lot of people doing this now, more than there were a week ago, a lot more than there were a month ago, and that will continue to improve moving forward.
Have you retained a group to do the community, the population health study that?
I know the RFP for that closed yesterday or the day before. I don't know who they selected. I don't know if that process has been complete.
One last thing, as we start to open up on Monday, are you worried that people may go into this with a false sense of security? Things are opening up, things are safer. I mean, really materially, not much has changed from when we shut down the economy. We still don't have
Well, we don't have a vaccine that works. We don't have great medical therapies. We have a couple of new therapies that we didn't have a couple of months ago, and they're not widely available, but they're there, and I think they will get better. Moving forward, there will be people who will stay home because they're not ready to come out. There will be businesses who aren't ready to open, and there will be some who are ready to go and who will open. I expect some people will be really cautious, and I expect some people will be not so cautious. And I hope that people will make a choice to move about on a cautious side.
Hey, Sam, we have one last question for public radio. It's piggybacks on that. So the businesses that are still to remain closed on Monday, if they defy that and open anyway, what is the plan moving forward?
The normal process. Someone will let our county attorneys know through the website, and we will look into it. Sometimes that's confusion about whether or not they should be open, whether or not they're allowed to be open, and most people respond to pretty simple communication and follow the rules. There really aren't a lot of people out in the county who aren't following the stay-at-home orders, and they understand how important these restrictions are, how important it is to move forward thoughtfully and responsibly in this reopening, and I expect most people to do that.
All right, thanks everyone.
Thank you.